Well, good afternoon, everybody, and a very warm welcome to this first online event that we've held, hosted by the Foreign Correspondents Club of Thailand. And any of you who are familiar with our club will recognize that we're not in the club premises, which has been more or less closed since the emergency declaration in Thailand. Instead, this is actually, and this is happening to so many journalists like myself, me broadcasting from my home. And we hope that we'll be able to hold more events like this to showcase what the Foreign Correspondents Club does best of all, which is a free-flowing debate about the most important issues of the day. And of course, there is nothing more vital than the challenge of COVID-19, both for Thailand and for every other country on this planet. And we have been trying to keep you informed through our weekly bulletin of some of the issues that have been raised. We've been writing pieces to try and keep alive the club spirit. But we've always wanted to hold events, bring back the guests who've always been the lifeblood of our club. And we are enormously privileged today to have Dr Tanarak Plipat, the Deputy Director General of the Department of Disease Control at Thailand's Ministry of Public Health, an absolutely key figure in Thailand's fight against COVID-19, a man who's been on top of this virus and the threat it posed right from the very beginning. We had a fantastic contribution from Dr. Tanarak when we held an event discussing the virus back in February. We're now 2.5 months on from that. All of our worlds have changed profoundly. We've all been affected. We're still learning a great deal about this virus. I would argue there is nobody better placed than Dr. Tanarak to answer questions that all of us may have about the virus, about how you deal with it, about how Thailand is dealing with it. And he's at the very center of Thailand's struggle against this virus. Dr. Tanarak, a very warm welcome to this virtual edition of the Foreign Correspondents Club. And thank you so much for giving us time. We know you're really very, very busy. I thought I would start asking you for a kind of overview. 2.5 months ago when we had you at the club, we knew much, much less about the virus and the impact it was going to have on our lives. Now we know a great deal more. Can you tell us what you've learned about COVID-19 in the past 2 months? What surprised you, what you didn't know 2 months ago, and your assessment of how Thailand is dealing with it?
Okay, thank you very much, Jonathan. It's great to be back, and thank you again for inviting me and give me a chance to talk about what we have done in Thailand recently. If we went back to the days that we discussed, on that day there are a lot of things that actually we don't exactly know, and we have learned quite a lot in the last 2 months. The situation from that day until up to today changed quite a lot. Then I believe that we just have our first, or if not, we are just about to have our first local transmission. But now if you look at the figures, we have already passed 2,000 already. And at that time, if you look at number of countries that have the situations, now it's almost all over the globe, and it has been called pandemic by the WHO. We have a lot of countries that have widespread epidemics already. We knew that the virus can spread very quickly. We learned that who is the risk group of having severe disease. We knew what population will have milder diseases. For example, if the children aged less than 15 got infected, we can expect that they are going to have very mild illness. And we also learned that if the elderly got infected, they are going to be the one who probably have a more severe end of the disease. We have learned that the disease can spread mainly by droplet and not by airborne. We have learned then we don't exactly know what antivirals could be used to treat the disease. Now we learn a little bit more that there may be some benefit of certain medicine that can be used to treat the virus. We now use the chloroquine, and we use favipiravir to treat the virus. So far, in terms of the virus itself, we knew quite a lot. We knew it clinical spectrum. We knew what is the sign and symptoms of the of the infected people. We knew roughly the proportion of the asymptomatics, which is around 30%. It means that if anybody got infected, about 30% may not show any sign or symptoms. The rest and may have a mild disease. About in total, about 80% of the infected population will get a mild disease, and just roughly about 15% may get severe disease. And on the severe end, we may have about 3 to 5% that may be in critical condition. But that's also depend on the age of the infected person as well. We learn how to, as I mentioned earlier, we learn how to treat. And one more thing that we still working on is how we can prevent the disease by mainly using vaccine. I believe that at the moment there are more than 35 or probably 40 of institution or research institution that's now working on vaccine.
The rise in confirmed infections, I mean, it's gone up quite steeply in Thailand and neighbouring countries in the last month, but it's still been a great deal slower in most of Southeast Asia than it has been in Europe and the United States, where we've seen huge numbers of infections and large numbers of fatalities. Do we know why that is?
Let me give you an example of what happened in Thailand. We have a very slow beginning. We have put in the very strong, I would call, public health measures at that time. But there are more than just public health measures. I will explain to you a little bit later. But in the beginnings, as you remember, we implement the entry screening. We have a good surveillance system in place for travelers. And then when we start to have local transmission, we put in place a border surveillance system so that we can capture the case faster and at the earlier time. And then when we start to have a spread, a local transmission, limited local transmission, we expand our surveillance a little bit. And any times that we have whatever the situation we are in, we try to stay ahead of the epidemics. By that I mean that we are doing a little bit more than usual. If we are in the stage 1, for example, we are working on the level of stage 2, so that we can stay ahead of the epidemic at any times. So if you look at the intensity of our measures, you can see that we are working very hard, and we put more measures than most of the European countries or even the Americas have been put into trying to stop the epidemics. Other than our public health measures, trying to detect the case earlier, we are also doing a very intensive what we call case investigation. Any case that we detect, no matter where the patient was, we'll have a team, we'll send a team to investigate, to identify the contact, and we working on trying to trace the contact person and quarantine them and ask them to self-monitor for the whole 14 days. And I think that's very strong early detection and prompt investigation of every single cases, no matter what situation we are in. Even when the times that we have 188 cases per day, we have more than 188 teams of investigation team that went out to investigate every single case at the earliest time that we possibly can. By doing that, if we can investigate every single cases, and if we can track every high risk contacts, then it means that we can cut the transmission of that patient. Other than that,
I was going to say, Dr. Tanarak, it would be fair to say, wouldn't it, that you focused a lot of your effort on points of entry, on screening, and indeed tracing the contacts of known cases, but the criteria that Thailand has used for testing has been quite limited, and the testing numbers in Thailand are quite low. What specific actions is Thailand taking now to measure and monitor the presence of this virus in the general population to know how widespread it is? Because that's an area people have been concerned about, that Thailand isn't testing very widely.
Okay, can I come back to that question a little bit later?
Sure.
I would like to end my first the previous question first. We have a very strong public health measure. That is just one thing. We also work very hard on personal hygiene. If you compare Thailand to other European countries, during the crisis that is starting from the middle of March until today, if you went out from your house, everywhere everybody wear mask, cloth mask or surgical mask. More than 90% of Thai people wear mask, and alcohol gel has been available in most of the public places, right? So these are very important personal hygiene. Wearing mask when you leave your home, and also wash hand as frequent as possible. That is one is public health measures. The second one is personal hygiene, and then the third one is we trying to communicate to Thai people so that they know what they should do in different situations. We have a lot of campaign in giving what we call health literacy to Thai people. That is the third measures that I think have been done so extensively, and the fourth one is social distancing, or I would like to call social measures. Is comprised of two things. One is social distancing, and the second one is travel restriction. Although we haven't pushed that to the limit yet, the social distancing, we haven't locked down the whole country yet. And even the travel restriction, we have a little bit of travel restriction, but it is not the lockdown of the whole countries. So four main measures that we are doing it, and we are doing it at different level. I mean, depending on the risk of getting the transmission in the country. So higher risk, we are putting more measures. Lower risk, then we are doing it at the at the at the lower level. That is one thing. For your question, now for your last question about the testing, I would like to tell you that this, although if you look at the percentage of the number of testing at the moment, we have done more than 100,000 tests, and if you compare to the country like South Korea or Germany, of course it is a little bit lower. But if you look at what we have tried to do, if you went back to, let's say, early January, or even by the times that you have me and Dr. Chu or Dr. Supaporn at your club, if you recall, at that time there were probably less than 10 laboratories around the country that can test for the virus. Today we have more than 80 labs, and probably by the end of this April, we will have more than 100 labs that can test for the virus. It means that by the end of April, every provinces can test for the virus. And if you look at our capacity, and if you look at where we are from the beginning, I would say I'm very pleased with the progress of expanding the lab capacity. We not just the public lab, but also the private hospital laboratories also help us in expanding this capacity. At the moment, we can test more than 20,000 tests per day, comparing to around 100 to 200 at the beginning of January. Um, you may think it's a little bit slow, but for the developing country like Thailand, I believe that this is probably one of the best you can see in the world. Now coming back to the point of we may not, the question that everybody complain about the testing. If you look back when we are trying to expand, when we was trying to expand our capacity, there was a lot of news during early March that someone have to wait for the lab result for 3 days, for 2 days or 3 days. Actually, the testing, we all know that it took about 3 hours to 8 hours to finish doing the lab for each round. But the reason that the result came very late is because there are too many people went for testing, and the capacity then was not really good enough to test all of the people who would like to know their infected status. So um, if going back and you ask, we are not doing a good job on testing, that is because our capacity is expanding starting from probably the end of February until March and April. Of course, it may not go as fast as everybody wish, but I think it is at the pace that I believe that is appropriate for the situation of our countries. If you look back, Korea and China are the countries that has been affected and have done quite a lot of tests. They have they have been affected by this epidemic long before Thailand. And if you compare Thailand with Germany and with Korea, I think it is comparing the developed countries with the developing countries that have, I mean, different level of resources. Um,
I don't think
but I
anyone
would
would
like
want to be
to
critical because we understand it. So it's a very, very tough job for anyone. But you mentioned the figure of 20,000 capacity per day. But in reality,
right,
the Ministry of Health is conducting maybe 2 to 3,000 maximum. And those are tests, that aren't people. And I'm just wondering whether, I know some people say you could scale up testing and that the way you're
right,
testing at the moment, you cannot find out how widespread the virus is. It's a very narrow remit. Even Malaysia is now doing 11 to 12,000 people per day, not just tests. So
right.
Malaysia seems to have gone quite far ahead of you.
Uh, I to explain this, you have to understand one thing: we cannot test everybody. There's one thing, and the cost of testing is very expensive, about 2,000 baht per test. Let's say we have roughly about okay. Now keep that in mind. We want to test enough, but we don't want to test anybody who may not have the disease, right? Um, I can give you two examples. The first example is we test the high risk contact. As I mentioned earlier, if we have any patients, then we trace the contact, and we are testing every contact that we trace on the days that we met them. And the the positive rate is around 2%. Around 2%. I mean, high risk contact, 100 high risk contact, we test them, and then they have the result of around 2%, right? This is for the high risk contact. Then you can think about the lower risk people, how the rate may be even lower. The second example was that that we had the situation in Phuket, right? And then we do investigation, and we find the pocket or the cluster in certain areas in Phuket. The team went down and test everybody's in that areas. We have performed more than 1,000 tests, one on 1,000 people. The we There were only one positive among more than 1,000 tests that we performed. You can see that areas has been identified as high risk area. It means that we have a pocket of the disease, and then we went down to investigate, and we test everybody in that areas. It's turned out only one in more than 1,000 tests turn out positive. So even in high risk areas, the positive rate in Thailand is very low, less than 1 per 1,000. Now you have to think about, if we test just 1,000, as I mentioned earlier, 1,000 tests that we perform in Phuket, it's just one area. It costs us already 2 million baht. 2 million baht. Just to find only one case. you can see how investment we have to do in order to find just one case. So I'm not saying that we are not going to do the testing. What I'm trying to tell you here is that we want to test where we can find the case. That is what I always call, we want to do the test strategically. So at the moment, if you ask us how we are going to expand this testing, and if this testing will relate it to whatever our strategy in the near future, I would say yes. Now everybody talking about, and I think I saw, I guess you are going to ask about it anyways. You will ask about the reopening of the countries. Of course, the reopening of the countries will come with our testing strategies that will be more open and test even more. So we have different areas, we have different situations. We have now more than 9 provinces that have not reported any single case yet in 9 provinces, and we have more than 35 provinces that haven't have a case for more than 14 days. That more than half of the countries. So you can see that the affected areas actually in Thailand was not that many areas. If you count the provinces that has been affected probably is less than 10. Bangkok, of course, Phuket, Chonburi, Chiang Mai, right? And then 4 provinces in the deep south, Songkhla, Pattani, Yala, Narathiwat. So that's about 8 provinces that has been affected. Those provinces should always look for the patient and should be strategically test for the cases. But now just go back to the provinces that doesn't have any cases or doesn't have any case in the last 14 days. What we are going to do in terms of strategic testing. First, they have to look for the case among pneumonia case. I think you all agree that every pneumonia should be tested for COVID at the moment. Severe pneumonias, any pneumonia that's atypical pneumonia.
And is that happening? Is every pneumonia case in Thailand tested for COVID-19?
Yes. Second is that we would like to test among the cluster of corona-like illness, or someone call it influenza-like illness, because it's basically the same, corona-like illness. If there is any cluster of influenza-like illness, then we are going to test the population, and if we find positive, we are going to test a larger population for that as well. So those are the plan for, not the plan, is what we are implementing at this moment in the provinces.
Can I ask, is there a target? Is there a target? Because some countries target so many thousand tests per million of the population. Does Thailand have a target for testing?
The number of tests, I mean, what
a target per million? Yeah, let's say so many thousand tests per million.
I think what we are doing is that we are going to test in the population that need to be tested, but we don't have a magic number of how many tests that we are going to reach. Okay.
Because what seems to happen in countries like South Korea and Germany is they expand their testing to a point where they can actually have a very good idea how prevalent the virus is in the population through sentinel testing, through random testing, and giving them an idea how many people who may be asymptomatic. Do you think that's just not possible for a country like Thailand?
It is possible, and we also plan something like that. But let me put it this way. We have those 2 populations that we would like to test first, okay? Pneumonias and also the cluster of ILI. And then the other group of population that we probably plan to do is that the walk-in patients, but not for all of them, but certain numbers of population that may miss certain criteria to be tested actually, and we want to test some of them to see how many we miss, right? So those are the main 3 populations that we plan to do the testing in the next step. And for the provinces that has case already, that already has certain case, the 8 provinces that I mentioned earlier, in these provinces, we believe that we need to test more than those populations. So we are going to look for the, let's say, when we have a new cases coming in, and if we saw any cluster in any areas, any specified areas, we are going to expand our testing in those targeted areas or those targeted population. For example, just give an example. For example, if we know that there's a clustering of corona-like illness in certain department store, and if we test those patients positive on single unit or single department of that department store, we may test everybody in those areas, so that we know the extent of the outbreak. That is one thing we are planning to do in the 8 provinces. So I think by that we it can give us some sense of where the disease how the disease spread, and we also plan to do some sentinel surveillance among patients who have corona-like illness, but that will be um, for surveillance purpose and to know the extent of the disease also.
We've all seen what's happened in Japan recently, where we had outbreaks much earlier. Then they thought they got it under control. Now we're seeing numbers spiking. The government will face a real dilemma at the end of this month about whether to lift some of the restrictions. What is the scientific data that you're going to use to decide how much you lift restrictions?
We are going to look at the number of cases, of course, and the trend. And for as I mentioned earlier, we have now more than 44 provinces that doesn't reported any case in the last 14 days. So those provinces may start to be to relax the rules a little bit first, and we also look at the establishment as high risk or low risk establishment. For certain establishment that consider high risk may be reopened later than the one that is at lower risk. So when we start, let me put it this way: all of the 4 measures that we are doing at the moment is the balance that we like. So when we start to relax one of the measures, we have to step up the other measure as well. So when we relax the social measures, we also like to, step up other 3 measures like public health measures. Public health measures, this also includes surveillance and doing more testing in the population. The health literacy measures and also personal hygiene. We would like to keep everybody's be informed and stay safe. We would encourage certain activity or certain success that we have done. For example, encourage people to work from home and leave their home only if necessary. Those kind of things should stay, and people should keep in mind that it's still not a good time to just go out and hanging around in the crowded places. Those kind of things should stay, and then we can relax the rules a little bit on lower risk first, and then we monitor the situation to see when we can relax certain high risk establishment later or venue later.
Dr. Tanarak, I've got a few questions that people have posted on our Facebook page. I'd like to put these to you if I can. They've come from some of my colleagues and some members of the club. I've got one from Al Kapuri. She's asking, to what extent is antibody testing available in Thailand? This, I presume, is serological blood tests, and I suppose also how useful those can be.
Okay. I'm waiting for a very good antibody test. When compared to what you said about to learn about the extent of the outbreak, I believe that for the antibody test, although it cannot say much about the current prevalence of the situation, but it will give us a rough idea of what happened since day one. That is how many people has already been infected in the countries. So far, we are working with several labs, even our labs ourselves at Bamrad Naraduns. We try to develop our antibody test. So I would like to ensure you that we are looking for a good antibody test, the one that we can test a lot of people in a short period of time, the one that easy to use, and the one that is not so expensive, so that we can test a lot of people. And we
You
plan
haven't
to
chosen one
do.
yet, is that right? There isn't one that's been approved yet by the Ministry of Health.
No, not yet. And I believe so far as that most of the testing that has been used, I've heard in Germany they have developed one of the very good testing, and they test their population already. The one in Singapore, that is still in research scale. There is not one that has been approved commercially yet. But as far as I would like to ensure you that even for the research scale testing, if it shows that it has a high validity and reliability, we are going to use it.
I've got another question here from Siobhan Robbins from Sky News. She's asking that she says, given the possibility that 80% of cases are either very mild or asymptomatic, don't have symptoms at all, isn't there a risk of the disease continuing to spread and sparking off a very big outbreak if testing remains low and you start to ease restrictions on movement? That as long as your testing is relatively low, you'll never really quite know how prevalent the illness is, and it's just going to take off again. You're going to have constant repeated outbreaks. Is that a risk?
I would say yes, of course, but you have to understand one thing. By testing today, by testing anybody today, it doesn't guarantee that he or she will not be infected. So if in theories, if you want to find every single infected people, you have to test everybody's for the whole 14 days. And I don't think any countries can do that. So by trying to eliminate this disease from any countries, it is not exactly possible by doing the testing on every single population every day for more than 14 days. So as I mentioned earlier, by doing extensive testing is help, but it doesn't guarantee.
There has been a suggestion that you can increase your capacity for RT-PCR testing by doing combined testing, that you take 30 samples, you test them all on the same assay, the same process, and you just look for any positives, and if there are positives, then you do more testing, but that helps eliminate negatives much faster, and that way you might be able to reach sufficient random testing to have an idea how prevalent the virus is in Thai society. Do you think that's a viable way forward, that you can amplify testing by combining samples together sometimes?
In theory, you have to understand one thing. By pooling the samples, let's say most of the times we pool 10 samples together. So you have 10 samples, and then you are going to mix those 10 samples into one single samples. One thing that will happen, always happen, that is, if among those 10 samples you have only one positive, what will happen is that you are diluting the numbers of the virus that you are going to be able to detect. And now it's depending on your performance of the test. Let's say that if your test can detect the virus at the lowest numbers of, let's say, 1,000 copy per ml, then when you mix things together, let's say one positive sample of yours have contained the virus at 1,000 copy per ml already. If you test them one by one, you may get one positive result. But then you mix it together. Now, instead of having one 1,000 copy per ml. Now you are going to have something like 100 copy per ml. And if your test performance are not that really good, then you are going to miss that one positive result. That is the principles. So by saying that, oh well, we can combine and we can pool, it doesn't always work that way. So, but I would like to inform you that we are now having a little bit more sensitive tests, and we are also trying and testing for the pool samples. Will it work or will it work or not? So the concept is good, and is may possible to be doing that, but to be able to do it or not, I believe that we have to test the principle first.
I've got a question here from Annelie Langerak from the Telegraph newspaper in the Netherlands. She's got three questions. Her first question is clarify that you really have 100 labs that can carry out sufficiently accurate PCR testing, because we've heard that. The other question she asks is, how many labs do you have in Thailand that are at what she calls BSL2 level? Now, I actually, that's unfamiliar to me, but perhaps you would know that. So I'm wondering, with both those questions, whether you can answer those. Are the 100 labs that have been mentioned, are they all capable of handling PCR tests at an adequate level? And how many of these labs have BSL2 level, if you know what that means, because I don't.
Yeah, BSL stands for biosafety level. Biosafety level 1, 2, 3, and 4. The highest is biosafety level 4. I believe that all the lab that is going to perform the COVID-19 testing will have at least certain areas of the lab that has been certified for level 2 in order to be worked on these samples.
And are there 100 labs that have sufficient BSL2 areas of the labs to carry out good PCR testing?
Right.
So that 100 figure is accurate.
Right.
There's another question here from Elaine Kurtenbach from Associated Press. She's asking what measures are being taken to try to control the virus among migrant worker populations, because there's a very high migrant worker population in Thailand. They often live in quite close proximity, and they don't always get full access to healthcare. Are there measures being taken for them?
Yes, of course. And we understand this very well. We cannot let any outbreak of COVID-19 happen in migrant workers. We knew that lesson from other countries, so that if there is, and from the beginning, if you remember, of all of the foreigners walking into Thailand, if they are tested positive, they are going to get the free treatment, and a containment of the disease right away anyways. So we have a lot of migrant workers, and we are going to take care of them very well, because if we let the outbreak happen in those populations, then one day it's going to affect the Thai people anyway. So any population, any pocket of population in Thailand will be taken care of in this situation, and everybody will get a free treatment of COVID, as long as they are in Thailand.
Is there any specific effort to reach out to migrant workers, because they're often not the kind of people who routinely go and use Thai services? We might not know what's going on there. Are there any measures being taken by the government actively to go out and find out if the virus is spreading, if there are problems there?
Yes, of course. In other provinces, the provincial health office is doing that, and in Bangkok, Metropolitans, and also one of the office of Department of Disease Control is taking care of that. And if I'm not mistaken, they have the activities that go out and reach out to those migrant workers who work in Bangkok already, starting from middle of March. From that days, they start to have an active reach out to those migrant population already.
I've got a question here from Frank Fu from Guanming Daily, a big Chinese daily, and he's asking about the drug favipiravir, which China has provided, I think, quite a large amount of to Thailand. Your own view of how effective it is. I mean, he's saying we know there's no miracle treatment, but how effective is favipiravir, which Thailand has bought, I think, quite a lot of from both China and Japan?
At first, when we start to import this medicine, favipiravir, it was just a hypothetical that it probably could treat the virus. And then a few weeks ago, China has recommended the use of this medicine in the moderate to severe cases. It can prevent the moderate to severe case to turn to severe cases. Since then, we start to not since then. Actually, we use the medicine to treat the patient already. Those recommendations give us more confidence to use in our patients. And recently, we have been treated the patient mainly of moderate to severe cases with these favipiravir drugs. By observation, there was the doctors from Bamrat Naradun's Institute of Infectious Diseases. They compare the result of the patient who has been treated with favipiravir and the patient who haven't treated with favipiravir. They observed that the patient who got the treatment have the lower duration of fevers and also have the shorter duration of what we call viral shedding. That means the duration that we can detect the virus from the throat swab or nasopharyngeal swab. So it seems like the drugs help the patient in both clinical and virological in that sense. But as I mentioned earlier, the drug has to be given or have to be administered to the patients a little bit early. If you administer the drugs at the point where the patient already turned to have a severe symptoms or have critical symptoms, then the drug may not work very well in those categories of patients.
There's a question here from Rachel Thompson from Sky News. She's asking how confident you are that Thailand has sufficient beds, ICUs, specialist medical equipment like ventilators. If you start to see a surge in cases like we're seeing in Japan now, which is obviously still possible, how well prepared is Thailand in terms of its actual facilities for infected patients?
In most of the countries, we have what I would say we have enough bed for patients in the normal situations. We may have probably plus 10, plus 20% extra bed in the normal situation. So those plus 10 or plus 20% number of bed that we have, that spare bed that we have, that is what we already have in hand, right? Plus certain, we all know that in most of the medical institute, we would admit certain type of patients that may not actually be admitted actually because of the patient request or for any other reason. That's probably constitute about another 10, 20, 30% depending on how each areas, how each doctors practice admitting the patient. So on the rough scale, I would say that probably in the countries we should have somewhere between 20 to 30 or 40% of beds that we can probably use in these emergency situations. But those number of beds that we calculate or we probably may have for COVID patients, it's not a lot at all. It's not a lot at all. I means that by saying that, I mean that we cannot let the disease spread freely. We have to put a lot of effort in trying to slow down the spread of the disease at any times. we don't have unlimited resources. If we let the disease spread freely, then I don't think we can handle it, and I don't think any countries will be able to handle it. No, and we have already seen the situation like in Italy, in a lot of countries in Europe. In the end, every country must slow down the epidemics because no countries can handle the situation of let the disease spread freely in this COVID pandemic.
And yet, of course, there's inside the Thai government, inside every government, there's a big debate about when to open up again, when to lift restrictions. The economic cost is very high. We know, a lot of people here are really suffering. What's your own view about when it might be safe for Thailand to ease the current restrictions? Do you think the way things are going now, we're only 2 weeks away from the end of April, that it is possible, in your view, now to think about lifting restrictions on the 1st of May?
Very good question and very tough question. I would say yes, but not in every provinces. I think the provinces that has a very good situations, the provinces that may not have any cases for the last 14 days on April 30th can be reopened first. And then they can reopen certain venue or certain establishment that at low risk. But by meaning of low risk, I mean the establishment or the venue that doesn't have that doesn't put too many people in the tight areas. The places that have a good ventilation, people who go there can wear preventing mask. Those kind of things can be considered at the low risk. And if you put the time dimension, is that people going there will stay there not for a very long times. When they finish their job, then they can leave. Those kind of venues or those kind of establishment are the one that I will consider to be a low risk. Can be reopened first. The places where people are in the crowded place, very bad ventilation, people cannot wear mask during being there, and people stay there for a long time. I can give you one example. For example, like the pub or the nightclub. When you want to drink, you cannot wear mask, of course, and a lot of loud music, so you have to shout at each other. May not be a good idea to be reopened at this time. So we can consider the provinces that are safe to be reopened first. We can think about the type of services that can be reopened first, and then we can continue doing that and look at what is the impact of the reopening to the situation, and then we can consider it a stepwise thinking.
Interestingly, when after the shutdown in Bangkok's nightlife, we saw a lot of people travel back to the provinces, hundreds of thousands, and we did see more cases of COVID-19 appear in the provinces. But it is striking that there doesn't appear to have been a very rapid spread of the virus in most provinces. Do you know why that is? I mean, we know that there's a very effective network of health volunteers in most Thai villages, and we know they're quite thorough in going and checking on people. I mean, we'll try to work out the reasons, because we all thought the virus would spread much faster outside Bangkok, and that does not seem to have happened.
Yeah, I think that by the times the Bangkok closed most of the services on March 20th or 22nd, I believe, if I'm not can still remember the date correctly. But around that time, when Bangkok started to close down a lot of services and establishment and venues, people leave Bangkok to go to different provinces. I would always say that if you have only one or two cases in your provinces, it is probably the easiest exercise that you can get. So if you can detect the case very early, very early, by actually, but at that time we also have the quarantine rules for anybody who leaves Bangkok, right? So we have a lot of health volunteers step in to identify those people who travel back from Bangkok, identify them, monitor them for any symptoms of COVID-19, and isolate them for or quarantine them for 14 days. Any any cases that occur after that can be detected, and then the investigation can start it and identifying the close contact and monitor the close contact so that they are not spreading the disease to anybody else. That can has a very good effect on stop the spreading of the disease just right away. That is what happened, I believe, in during those time between the end of the second half of March until today. So you may see cases in a lot of provinces, but those cases that they identify can be can be can be stopped the transmission very effectively by doing just public health measures.
Are you surprised now at the relatively low number of infections in Thailand? I mean, a lot of people look at it and they're surprised even that you're so far behind Malaysia. Is that surprised you too, that we haven't seen COVID-19 spreading in Thailand the way that it has in so many other countries very quickly?
Very good question, and it is the very difficult one as well. But recently, I saw one of the articles that they are doing the research in the poor. I mean, on the poor population, there are very striking numbers that also surprised me. Is doing the survey of how many poor in the cities wear mask, the closed mask. The research said that around 90%, even for the poorest population in Bangkok and in big cities, that using masks when they went out of their home. And if you look at how many people in Bangkok at the moment wearing masks, then you can say that you can see that or you can say that our some of our intervention or some of our campaign work very well in the countries. If you look at how many, uh, for example, during the last 3 or 4 weeks, the traffic in Bangkok is very good comparing to what happened days or weeks before. Um, the trains, sky trains, people in sky trains now it's not that jam packed in the rush hours when compared to earlier. So I mean, when you think about this, not just the the public measures that will help this with the situation, but all of the effort of every single Thai people that that is now doing their part in trying to stop this transmission that are currently helping the situation at the moment. So I may not give you an answer of what measures that help us with the situation at the moment, but I would say that, but I would like to guess that every single measures that we are doing with all of the collaboration that we got from every sectors of Thai societies, that is now slowing down the epidemics at the moment. And
I suppose
when talk,
I'm wondering whether, as a health expert, whether you lie in bed at night worrying that perhaps the real infection rate is much higher and we just haven't seen it yet.
I would say no. One of the good reasons is that if you think that we have a high infection rate, we cannot hide the number of pneumonias. If we have a lot of patients there would be a lot of pneumonia cases in Thailand, just like what happened in Italy. And we cannot hide the number of deaths. If we have a lot of infection, we have to have a lot of deaths in Thailand already. But what is very striking to me is that recently before the rain came out, we have also lowered the number of ILI in the countries and lowered the number of pneumonias in the countries. I have to recheck these numbers again, but some of my staff told me just a few days ago that he has seen the lower number of influenza-like illness and also the lower number of pneumonias in the countries this year's compared to last year's. But as I mentioned to you earlier, I have to recheck this number myself again. If that is true, it's telling us one thing is that is, although we did not test that many people comparing to others, but it's telling us one thing, and I would like to say this: we cannot hide the number of pneumonia. We cannot hide the number of death. If 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 you think that we are not able to control COVID-19, now we have to have the situation where people are crowded at the hospital. We must see a lot of people who need respirators already. We need to see a lot more deaths when compared to the last years. But we haven't seen that. We haven't seen that. We haven't seen the situation like what we are seeing now in Europe or in Italy or even in the US. So I think those situations or those numbers also reflect on the situation that we are seeing. But I'm not saying that we are not aware of what may happen. We may not, of course, we may not be able to identify every single cases. No, but no country can. No matter other country like Korea or Germany, although how many testing they are doing, they cannot detect every single cases. We cannot too, but we are testing enough to be able to control the situations. And I think one other thing is that we are not using just one single indicators to to evaluate the whole situation. So we are using the number from other sources as well to inform us on what is going on in the country at the moment.
I've got one last and possibly most difficult question that's come from Todd Ruiz from Bangkok Coconuts magazine. He's asking, given the examples of unfavorable information being suppressed, he's talking about reports about inadequate hospital PPE. We know that the government under the emergency decree is being very strict about, information that could be, upset public morale and so on. And he's asking, could you give an honest appraisal of the pressures on health officials like you to be presenting a positive image rather than maybe something that might be a bit more negative but possibly more honest?
Okay. Although it's difficult, but I like it. I would say this. I have been working in the on this kind of epidemics or outbreak for, I would say, for my whole career, beginning in the year 2000, where I came back from studying abroad. I faced SARS, avian influenzas, influenza H1N1 2009. Every single epidemics will have different challenges. We have different challenges, and there are some different challenges in this outbreak as well. So far as I believe, for me, I don't know for any others other spokesman, but just for me, I haven't been told personally that what I can say or what I cannot. So at the beginning of just before the webcast, as I talked to Jonathan, I am joking with Jonathan that he can ask any question and I will answer any question, because so far there haven't been any restriction for me, for myself, to say anything on the situations. Probably they probably know that I will not say something that bad for the Thai. But for the situation of PPE, when anybody asks me about the situation of PPE, I will always say tell the truth. I would say something like this. We have been known the situation before. We Let's put it this way: we have an estimate of what will happen and what we should prepare. In the early of the epidemics, I have informed our teams, our logistic teams, that they have to prepare enough PPE for the for the for our healthcare workers. And by the times that we start to react, every country started to stockpile their PPE. So since day one, when we start to stockpiling our equipment, there is not enough equipment worldwide, but we are lucky enough. And I still consider that we are still very lucky that we got the donation of the equipment from abroad at the very early stage. We were able to buy enough equipment for quite some times. And so far, to me, if everybody's and I mean everybody's follow our protocol on how to wear their PPE, there should still be enough PPE for quite some times. So having enough PPE doesn't mean that you have to buy it a lot, right? I can give you an example. There is one hospital. They come in and told us stories about they have one case of COVID-19 who need intubation. By need intubation, that they need an assistant. They have to put the tube in their trachea. And that one hospital, for the just one single intubation, they have used 20 PPE. So they have 20 of their staff equipped with full PPE, cover all, N95, face shield, and goggles. You can see that if it's happened in other hospitals, probably 2 or 3 staff maybe may get the full PPE. Not 3. I'm sorry, 3 or 4 staff may use full PPEs instead of just of 20s. By using the limited resources, so unlimited like that, no matter how many PPE you get, it will never be enough. Or on the other occasions, the staff who should probably wear the what we call the waterproof surgical gown, that should be enough for their work. But instead, they may choose to wear what we call cover-all PPE. In that sense, no matter how much PPE or how many PPE you have, you never get enough of it. So on one hand, we are trying to get our hand on as much as PPE that we can. On the other hand, we have to also train and ensure our staff of what level of PPE they should use in what certain situations. That are both very important. And and the other things when when we learn that we may have a shortage of PPE like N95. A lot of people come in to help. Some come in to help us with how to reuse N95 respirators, how to disinfect it, how to reuse it, how to sterilize it, so that we can use N95 for more than just one times. That will also help the shortage. And I can ensure you one thing, that is the shortage of PPE is a global situation and will not only affect Thailand. And these kind of things, I think if we are reasonable enough, and if we, it is not the problem, it is not just one of the problems, it is the complex issue that if we can explain it out reasonably, then I think we can talk about anything.
Dr. Tanarak, thank you very much indeed. That was explaining particularly about PP, which I think has been a big people here in Thailand. I'm going to wrap it up there. We'd intended to go on for about an hour. Thank you so much for giving us your time, for answering all the questions that I was able to put to you. We're very grateful. It's helped a great deal. And thank you, all of you who've joined this special online event for the Foreign Correspondents Club. A big thank you in particular to David Foster and Giant Digital Media, who have arranged all the mixing of this. It's why you can see it on Facebook Live. Any of you who missed parts of this broadcast, we will put it up on our YouTube channel. And do keep checking in on the Foreign Correspondents Club website and on our Facebook page for any future events. I'm going to wrap it up now and say thank you and good afternoon to all of you.